And today we have Dr. Is it Daughtry? Daughtry?
Daughtry.
Okay, sorry.
No, you're fine.
And she will be talking to us about health communication. So I'm going to ask her some questions, and then while we're talking, you can go ahead and ask any questions you have in the chat, and we'll get those answered. So if you wanted to start off by introducing yourself before we jump into questions, or whatever you want to do.
Absolutely. So my name is Dr. Crystal Darnell, as Avery said, and I am a new faculty member at NKU. So I started in August, so in the middle of the pandemic, and that's been fun to be working virtually almost my entire first year. So I have a background in health communication. That's what I got my PhD in. And specifically, I study health narratives in Liberia, West Africa. So I'm really interested in how people share their health experiences and what those narratives can tell us about how people seek out information, how they make decisions. So if you ask someone to tell a story about their life, you can really learn a lot about that. And so that is where my research is centered. I sit down, I interview people, I ask them to tell me about their lives, their experiences with health and illness, and then I go through and I, kind of comb through that and try to figure out what's going on. I work on some other stuff. At NKU, I'm working on a couple of different COVID-19 projects. One, some of my students developed a peer-driven health campaign. So this was to increase awareness about various prevention methods. And then I'm working with another health comm faculty member, Dr. Darnell, on kinship caregiving during COVID-19. So I do some other things in health communication that I can go into more detail if you would like later on.
All right, awesome. So our first question is kind of simple. Just can you provide us with a definition of what health communication is?
Absolutely. So health communication, especially if you're looking at like various academics, everyone's going to kind of have their own specialized definition. But if you strip away all of that and look at the core, most of us, or most of the people that I've known and that I've read and researchers, really boil it down to it's a very simple definition. It's the way that we seek, process, and share health information. So the health communication field is fairly new. I believe it kind of really picked up in the early 90s, maybe a little bit in the late 80s. So still fairly new in terms of academic scholarship and research. So this definition is widely kind of like the foundation. So it's simple. You just need to remember seek, process, and share health information. Where it gets a little more complicated is if you look at each one of those individually. So seeking information, processing information, and then sharing health information. And you'll really begin to see kind of how robust the health communication field really is. And it's not a siloed field. So we intersect with nursing, medical practices, psychology, sociology, communication. We really intersect with a lot of other, areas of academia and research.
All right. And what are some different careers in health communication?
Yeah, so it really depends on what your specific interests are. If you are someone who is studying health communication, you can work for a nonprofit, or you could go to school for a really long time like I did, and you can become a professor. You can also work for organizations like the CDC, hospitals, you can work in administration, you can be a healthcare advocate. One of the things that a lot of students are really interested in is being a health advocate. And all that is you're someone who is going to advocate for the patient. So, for example, when my grandfather was in the hospital that he was receiving care at, they had multiple health advocates. And that person would, be assigned like a caseload. And they would come in and they would help make sure that my grandfather knew what was going on, made sure that he didn't have any questions, maybe that he was afraid to ask the nurses or the doctors. They also helped my grandmother? Did she have needs? Did she understand what was happening? What could they do to make my grandfather's hospital stay better for both him and my grandmother, and then our larger family who was kind of in and out? This was obviously pre-COVID. So that health advocate really plays a crucial role in what we call patient satisfaction. So am I satisfied with the level of care I receive? And so it's a lot more than just I'm going to the doctor, I'm having, chest pains or whatever, and do they treat that? It is really a holistic approach to health. And so health advocates really facilitate that for patients. So that's a big one. Lots of people also like working in the nonprofit sector. So working with community organizations to assess health needs, and kind of being the liaison and the expert really in health communication. And that goes back to that definition. Like as a health communication scholar, you know that people are going to seek out information. So you need to know how they do that. You need to know how they process that information once they found it. And then you also need to know how they're sharing it. And so it's kind of this cycle of really understanding the whole process of health communication. So health advocates do that. People who are working in nonprofits do that. And again, like depending on hospitals, they have lots of positions that if you study health communication, you would be qualified for. For example, I lived in Memphis for 10 years, and St. Jude obviously is located there. And I have several friends who work in communication and health communication at St. Jude. And so they work with things like organizing patient days for the children who are able to get out and leave the hospital. They again work with families, making sure that they have kind of all the logistics lined out. And then, there are other things like if you want to be a professor, you could go and do that. You could research and figure out like how do we craft health messages. And so there are a lot of different career paths that you could go down and really I always ask students, like, what are you interested in? Like, well, what do you want to do? Because usually you can fit health communication into that. So my friends who are nurses have gone back and picked up, health communication classes because they see the value of knowing how to communicate with their patients, because that then improves the level of care they can give. So really, there are lots of options there.
And how does somebody become certified in health communication?
Yeah, so that one is I'm going to say fairly simple. Because health communication is still relatively new, there are not many universities that have a health communication major. So, right, most universities you can get a major in history, you can get a nursing major. Um, but NKU is actually one of the few programs in the country that offers a specific health communication major. And so if that's something that you're interested in, one, I would say check out the health comm program at NKU because we're doing really exciting things. But also we have a minor. So um, maybe you're interested in nursing and that's going to be your major, you can pick up a health communication minor. Or you're interested in, sociology, you can pick up a health communication minor, or any of the health sciences field. It's really easy to pair health communication with those areas of study. So one of the top ways to do it is find a university that offers that degree program and go through the courses either as a major or as a minor. And then we are seeing an uptick for other professionals. So let's say medical doctors, nurses who already have their degrees, but are coming back and getting that continuing education. One of my advisors when I was in grad school developed a program for nurses. And so once a nurse has once they're an RN and they have their degree, they can come back and get continuing education courses through her program, which is all about health communication for nursing and end of life care.
And what was your specific educational experience like? Where did you go to school and what kind of classes did you take? What were they like?
Yeah, so I kind of maybe are like a lot of people. The what majored in undergrad is it's kind of different than what I ended up doing now. So I went to the University of Kentucky for my undergraduate degree, and I was in the College of Agriculture. And in that college, they had a program that was community development and leadership. So I've always been really interested in working at the community level, which does kind of tie into the health communication research I do now. It's community based. Once I finished at UK, I moved to Texas and I went to Abilene Christian University, where I received my master's in human communication. And while I was there, I studied media and communication, specifically looking at how our consumption of media influences our thought process. So, again, that's still really helpful if we go back to that definition of health communication. Often, when we're looking up stuff, we're going to the media or we're seeking out information from the media. And so, there was kind of a theme throughout my education background that ultimately led me to the University of Memphis, which is where I finished my PhD in 2019. So I'm approaching a couple of years of having my doctorate. And while I was there, I took a lot of different classes because if you look at that definition of health communication, you really need to be well versed in all aspects of the communication discipline. So words matter. So I took rhetoric classes that talked about how we persuade people and how we use words to kind of get the end game that we want. I took classes in media, mass media. That was helpful in telling us, again, like channels of communication, interpersonal classes, and of course, health communication classes. So classes about interviewing, public health classes. I took classes in sociology, and all of those really were through the lens of health communication. So when I was taking my public health courses, I wanted to know how can communication further advance this public health, objective, or in sociology, how does communication advance this particular thing? And so while my classes were not like Health Com 1, Health Com 2, it really was everything that I did. I looked through it like I had on a pair of sunglasses that were health communication. And so, depending on where you go, they have kind of different offerings. But at the University of Memphis, there were 3 faculty members there who specifically study health communication. And so I was really lucky to work with them in understanding what the discipline looks like and how that could be applied to the things I was interested in, which was health at the community level.
And our next question is there a growing need for employees in health communication?
Yes. And sometimes I know this is a big question for high school students and college students, like, what can I do with this degree? And I always tell people when I'm teaching kind of intro level courses, go to any job site that has job postings and look at what they want their employees to have. And oftentimes, one of the top 3 skill sets they're looking for is communication. And so take that and now put that in the high pressure situation of healthcare and in the healthcare field. That is a key. If you have a doctor who's not able to communicate, then you're not going to be able to receive the care you need to live a healthy lifestyle. And that's a problem. So, yes, there are tons of jobs, opportunities, and the need for health communication scholars. And that looks like, lots of different things there, especially in the Northern Kentucky, Cincinnati area. There are lots of options there. So yes, the communication skills plus the lens of health communication, absolutely. There's a job market for it. And it's growing every single year.
And what are some common challenges that people face when they're working in this field?
There are, this is kind of the challenging part and the rewarding part. They're connected. So depending on which aspect you're going into the field, it really kind of depends on what the challenge is going to be. Ultimately, because we're dealing with other people, that can be a challenge. So trying to understand the other person, and because it's not feasible for me to tailor every single health message, Avery, let's say to you, and then, a different message tailored to Joe down the road. People who study health communication really have to work to cast a really wide net to try and capture as many people as they can for whatever message or intervention they're trying to do. So that can be a challenge, is guessing and trying to convince people and persuade people that what you are telling them is one, true or helpful or relevant. That can be a challenge. And I think that is probably the moment that all health communication folks are like kind of pulling their hair out and banging their head against the wall thinking, how do we do this? On the flip side of that, once you figure it out, it's really rewarding to be able to see, like, take, for example, one of the things you could do is you can design health communication campaigns. And you might think, well, I don't even know what that is. So for the past year, we've been in COVID, and you've seen, like, if you're in Kentucky, the big thing is the governor does like hashtag shots of hope once they started vaccinating, or hashtag Team Kentucky. That's a social media campaign to raise awareness around this very serious health issue. So once you see people starting to adopt those hashtags, right? So you get vaccinated and you show your, right, you're kind of hiding your card, and you put hashtag shot of hope. You're participating in that health campaign. That's really the rewarding part, is to see the impact those have on the community. I have a friend who works in Haiti, and her health campaign is clean water and making sure that people understand, like, the value of, like, washing their hands and cooking and bathing with clean water and drinking clean water. So trying to develop that to capture as many people is really nerve-wracking. But once you see people start adopting those healthy behaviors, it's like, yes, this was perfect. It was worth kind of the headache of getting to that point. So anytime you're working with other people, and especially in health, where oftentimes the people you're working with are stressed out, they're nervous, there's lots of anxiety, especially when you're looking right at a patient who might be facing a cancer diagnosis. There are lots of other emotions that are at play there that can be challenging, but once you're able to get past that and work through it, it really can be rewarding to see what you've done and what you've been able to accomplish.
And our next question was, can you explain your current position as a professor and then previous jobs you've had in health communication?
Yes. So currently, like I said, I just got to NKU, and I teach health communication, the health comm class, which is like the intro level course for the health communication majors. And I also teach health campaigns, which is designing and evaluating current health campaigns, which prepares students for, jobs at places like the CDC, the National Institute of Health. So I do that. And then I also still work with community organizations. So some of my students partnered with Campbell County Drug Free Alliance last fall, and we developed a suicide awareness postcard that went out to middle and high school students. So I still work with community organizations like that. I still have connections in Liberia, West Africa, and I am working with communities there once I'm able to, travel and return back to Liberia. And I've done that my entire career. And so that's usually the capacity in which I'm working in health communication. So we would call that, I'm an applied practitioner of, communication theory. So I write a paper or I research something, and I'm more interested in how this is actually applied in a real world setting versus, like, I'm not trying to come up with a new theory. That's not my research focus. My research focus is taking existing theory, existing ideas, and then translating that to the general public for whatever community I'm working in at the time. So like I said earlier, Dr. Whitney Darnell and I'm working with her right now. She is doing a project for kinship caregivers in Kentucky. So we're interviewing kinship caregivers. So these are like grandparents or aunts and uncles who have had to raise their grandchildren or nieces and nephews because of addiction struggles of the children's parents. And so we look at various theories that are out there and we say, okay, how is this applied to this specific group? And so I've done that pretty much from the moment that I entered into health communication. Even when I was a graduate student, I worked with HIV and prevention efforts in Memphis. And so that's typically what I've done in my experience. And then I've taught at the college level pretty much through my master's. So it's been 10 plus years that I have teaching and researching in health communication.
And then what are some skills that are necessary to succeed in health communication?
I think they're the skills that you're going to find in just about any job. So, one, you need to be organized. Often, right, that you're just kind of working as a team, and you don't necessarily, unless you're working on a really major project, you have to be self-driven, which means you also have to be organized to make sure that those projects get done on time and that you're, able to follow through with what you said you're going to do. Uh, you have to be a good team player. And this is a thing that I try to tell, college students, high school students, we always hate working in groups, but I work in a group all the time. And so having those group skills are really will set you apart, especially if you're looking at like employers and stuff. If they see that you're a good team player, that's what they want. They want employees who can work well with others, who are adaptable, they're organized, but also, I would, uh, this is maybe what I highlight most often for my students is you have to have critical thinking skills and you have to be able to kind of have creative problem solving skills. So if we look back at like health campaigns, right, here's a problem. How do we fix this problem? Or how do we design a message that addresses this problem? And so you do have to have some kind of creativity in terms of problem solving and critical thinking.
And you kind of touched on this a little bit earlier, but our last question is who do you work with on a day to day basis? So, as a professor or as somebody working in health communications, do you work with patients or coworkers?
Right. So typically there are four faculty members in the communication department in the College of Informatics who kind of focus on health communication. And all four of us work together. We're actually doing a project right now about vaccine hesitancy among first responders. And so the four of us work together. And then I work with, people all across the country. I'm working with right now a team in Idaho who are looking at health literacy, which is one of the areas of communication that I am specifically interested in. I stay in contact with the people I know in Liberia, West Africa. So really, it depends on kind of what's going on. I'm trying to build additional connections in Liberia. So here the past couple of weeks, lots of email back and forth with my connections in Liberia to see like, looking to the future once COVID restrictions have been lifted, what does that look like for me to come and bring your research team to Liberia? And then, I mean, sometimes, right, we are dealing with patients, depending on kind of what we're studying at the time, or individuals who are impacted by, various health concerns. Other times we're working with nurses or doctors. It really just depends on what project we've got developed and working on. So like we're working with first responders and we work with people in the community. So it really does vary day by day. So if you're someone who's like looking for a stable job, but also like a major or a focus that allows you to work with lots of different people. Health communication really does. We're doing something new each day.
That was our last question. So, oh, looks like we have one question in the chat. It says, does the health communications program work with or separate, sorry, or, oh, do you work with other departments or are you separate from departments on campus like traditional communication, the English department, or business?
Yeah, so we're housed over in the communication department. Like when I go to faculty meetings, I'm with the other communication faculty. I also teach other communication courses. So I teach public speaking and I teach intercultural communication. So health comm is my focus, and that's the area that I'm considered like the expert in. But I also am really well versed and qualified in other areas of communication. Lots of my students have a communication major, but then a health comm minor. We have a lot, probably the majority of my students have a health sciences major, and then they're picking up a health communication minor. And so, like, if you're trying to figure out, like, maybe I can blend two things together, talk with your advisor, and then talk with people, like, don't take my word for it. Get in contact with Dr. Darnell or some of the other health comm faculty, Dr. Zach Hart or Dr. Andrea Lambert South. And they can also tell you, like, yeah, this would be a good fit. This is how we can work together with other, departments on campus. Does that answer your question, Anthony?
If other people want to add some questions, they're welcome to. I'm kind of curious to hear more about your experience in Liberia and West Africa and what you did there.
Yeah, so this is like the area that I get most pumped about. So I first went to Liberia. Let me think. It was a long time ago. 2012 was my first trip, and I was not going there to research. I was there on a humanitarian um, trip. So we were working with an orphanage that also has a school with it. And I was with a team from Memphis, and we were going to uh, train teachers and to really just relieve some of the workers at the orphanage. So we were there to basically babysit for a week. But it was really fun because, it gave them the chance to kind of take a break from their normal jobs. And in Liberia, like, it's not common, like, folks are not taking 2 weeks of vacation just because of kind of the political and economic culture there. So we went to Liberia, and Liberia was established, like the country that we know now, was established by freed people of color. So in the US, I guess this was maybe a few years before the Civil War. And so enslaved Africans were being freed before the Civil War, and they were migrating north. So they didn't want to be in the South anymore, obviously. But because of racism and just lots of different issues, people in the North were like, wait a second, we also don't want, they can be free, but they can't be free here. And so one of the solutions, which was not great, was that they would ask for volunteers, and they would send those freed people back to Africa. Now, it didn't mean they came from Liberia originally. Most of them did not. So the US began to colonize West Africa, and Liberia was the place where that happened. So there's lots of really difficult history in that country that has trickled down to modern day. So back-to-back civil wars. There's lots of economic concerns, political concerns. But one of the cool things that for me as a researcher is that English is one of their official languages. So they have 16 tribal languages, but then, like, the majority of Liberians also speak English. And unfortunately, that's the result of the colonization efforts. But that means that I can communicate just about with anyone in Liberia that I want to. So I went, and in my time there, I realized that there were lots of different health concerns that we didn't maybe understand as Americans coming into the situation. And so I began to kind of ask some questions, and just kind of, like, I was just curious. And so my advisor, once I came home, was like, you should focus on this for your studies. Like, this seems like it's really important to you. And so I began multiple years of going to Liberia and researching health communication. Specifically, I sit down with folks and I say, yeah, tell me, I have an interview script. And I ask them, basically, tell me, like, what health concerns have you had? How do you treat them? How do you find out information about them? And I let them just tell me their story. And then I come back home and I analyze that for, lots of different stuff. So um, I've been 3 times. Well, last time I was there was in 2016, right before they were declared Ebola free. And so some of my research specifically centers around crisis communication and Ebola. So yeah, I don't know. What else would you like to know? I could talk for hours about my time in Liberia.
I think that kind of covers what I was curious about. I think that's awesome. So Mary asks, how long does it take to get a health comm degree? What is an entry level position and what does it usually pay?
Right. So your health com degree, and I had this pulled up and now I don't. It's going to be like your typical, college degree. You can get done. We are actually this fall, I believe. I hope I'm not misquoting them. We are starting the AP, so the accelerated program for health communication. So you'll be able to get that at a faster rate than normal, depending on how much you would like to do. Um, an entry level position, it really depends specifically on what you want to do. So if you come in at a hospital, right, like you're not going to come in at the CEO level, but you might start even as a volunteer in high school. So one of my friends volunteered with St. Jude since they were 16, and then at 25, once they finished their advanced degree, they went and worked for St. Jude. So it really, again, depends on the area you are and what that organization considers to be an entry level position. If you're looking at the government side of things, entry level position is going to be someone straight out of college with a college, degree, and you're going to be working kind of running the errands, if you will. You'll be pulling research studies, and you're not going to be leading the team, but you're still going to be a team member. And that kind of, Mary, goes into, what does it pay? And so the pay for someone working in a nonprofit is drastically different than someone who's working for the CDC, even as an entry level position. So nonprofits, right, you might get 30, 40, depending on how large the nonprofit is, 40,000, versus I've seen some entry level positions for the CDC and the NIH at 50, 60,000. And those positions can go up to 200,000, 250,000, depending on your experience. So of course, the more experience you have and the longer you're with that organization, the more you're going to be paid, but also like what level of responsibility that you might have. So I have a friend who works at the National Institute of Health, and they work in messaging. So they work on health communication messages, and they're probably at a mid-level position, but they oversee multiple teams, and they make, based on the government kind of pay scale, they probably make 100 to 125,000 a year. So it really depends. Like, I know I can't, Mary, give you like a specific answer on the pay and the entry level, because it really does. That's going to vary by area. That's going to vary by organization. But for the health comm, you can, on NKU's website, if you go and just type in the search bar health comm, you'll pull up the whole program there that kind of walks you through your course work. I hope that's helpful.
All right. Looks like we don't have any other questions for now, but you are still welcome to put some in. Is there anything you wanted to add?
I would just really encourage all of you. I know a lot of people where they really are like, this goes back to, and Mary asked us, like, can I get a job and can I make a living? And the answer is yes. So oftentimes we see, and this is not, I don't want you to take this as negative, but we see students who they think, okay, I'm going to go be a nurse and I'm going to be a travel nurse. And they get into nursing classes and they realize maybe that's not what they want to do, or they are not interested. Maybe the A&P class or some of the classes are really not what they want to do. And they realize they really are afraid of needles. Oftentimes they still want to work in health, and they're trying to find an outlet to do that. And I tell them, like, you should try out health communication. One, you can still work with nurses. Like, if you're interested in that, you can still work with medical professionals that are in the hospital kind of clinical setting. But you can also really shape things like policy, health at the community level. And again, like, that's really important to me, because we could have all the health information in the world, but if the people at the community level don't know that it's available to them, or they don't know how to access, healthcare, then what's the point? And so I would really encourage each of you to kind of look into it, and don't take my word for it. Like, talk to other people who are in healthcare or in health communication or just in communication, to see ways that this might fit into like your career goals or something that you would be interested in. And then, of course, like, I can put my email in the chat. If you have other questions that you think about later, like, send me an email. I'm open to chatting via email or Zoom or Teams or whatever.
All right. Well, thank all of you. And feel free to reach out if you have any more questions.
Thank you.
Have a
Thank
good
you.
day.